I'm Pinky Marquez, and we are here at CSA Medical Aesthetics. And
my name's Kathy Castañeda. I'm a vocalist, and I'm also going live streaming on TikTok. If you want to catch me, Mama Cat 247.
yes, and
Yeah, and I'm Lloyd Young, so I also stream on TikTok every Monday, Wednesday, Friday at 6:30 in the evening. So I hope you can catch one of my streams.
what, under Lloyd Live?
Lloyd
Live.
Live. Yes.
We
Lloyd
also sing
Live.
with the group Music Making Company, and Chiki and Leo are not here with us today. Yeah, and will be with us soon. So here we are, ready for CSA Medical Aesthetics with Dr. Contessa Salvador. Well, we're here because aging is a natural process, and we're still in the entertainment business. We sing a lot in front of everybody on cameras and on stage, so we need to look youthful and young. And of course, our skin going down because of gravity. So Doctora will take care of it. Kaya nandito kami.
This was because of Pinky, and she invited us here, and we were looking at her face, and oh wow,
Getting
is
there.
that what happened? Okay, we wanted to. That's why we're here.
Okay, well, we're actually supposed to be 5, attending the procedure today, but unfortunately, 2 of our members couldn't make it. And since we saw the effect on Pinky,
Aba.
she invited us to be here. And, well, we're excited.
Exciting. And he's also always on camera on TikTok. So close up talaga yan palagi. Of course, our concerns are always the skin, and we have to look youthful, and the lines. So Doctora, that's her forte, to remove lines and all these lines around her face. That's all I can think of. Diba?
I think it's mostly also because, of course, we do put makeup when we perform, but it would be nice to go natural and just be, you know, like fresh looking even without the makeup on.
Yeah, I agree with Kathy because most of the time we're under the lights, although, well, sometimes I use makeup, right? Because when we're exposed under the lights, I mean, like it changes the
and on
color.
camera.
You're right, that is so true. And, well, my main concern is basically the lines on my forehead and the sagging skin. So it's going to be an exciting journey having this procedure.
Don't forget to subscribe and like.
All right, ladies, are you ready?
Ready, Lloyd?
All right, here we go. 1, 2, 1, 2, 3.
Boop, bop, boop, bop. We're the Music Making Company.
Boop, bop, boop, bop.
And we're here at CSA Medical Aesthetics.
Boop, bop, boop, bop.
Ready for procedures. Boop,
Boop, bop, boop, bop. Boop, bop, boop, bop.
Hi, Ma'am Cathy. Good morning.
Good morning, Doc.
Here po. Welcome to CSA. So, Ma'am Cathy is early 60s ang age.
64.
Ayun, 64. But you're looking young, okay?
Thank
Beautiful
you.
skin, okay? On the upper third of the face, we notice already this presence of the lines and wrinkles here, which is, of course, at this time, we'll see some of those creases because of the constant facial muscle movement. So,
Okay.
we develop these kinds of lines, and we've noticed we have the not only dynamic lines, even the static lines, okay? And as we go lower, like in this upper eyelid area, we already see laxity. And because of that, there's the kind of hooded eyelid already. So we also want to treat this one. We want to treat the lines and creases. Plus, when we go to the temple, we notice some volume loss. Some like it's kind of already inwards. So because of volume loss. And
Is that because
to-
of glasses? Not necessarily.
Not necessarily.
Okay.
And leading to kind of the corner of the eye going down already. Okay. And also our concern under eye, skin laxity as well. So this is on the upper half of the face, okay? But looking at the skin of Ma'am Cathy, still a young skin, I could say, right? And also nasolabial area here. So this part, as time passes by, it gets deeper because of the volume loss also. And going down here, some of the jowls already. So basically, that's the one that we see right now, okay? And we'll do a treatment that will be gradual because it's the first time
Okay.
for Ma'am Cathy. So we'll do a non-surgical procedure, an enhancement procedure, something that will just refresh us, revitalize us naturally. Like looking just like, you know, at our age, okay? Yeah, young looking, but still natural look, okay? And we don't want something that will make us look like artificial or
Correct.
or the others are saying kind of frozen face,
Yeah.
no facial expression. And because of what you do, you need to have some facial
Yes,
expressions.
definitely.
Yan. So for our first treatment for Ma'am Cathy, starting treatment, we'll relax the facial muscles here, and then we'll also help the nasolabial fold here, restore volume. And then little by little, we'll do another treatment in our next session.
Okay, Doc.
Okay? So let's start. So we've already done a procedure for Ma'am Cathy. We did the upper third injection of our botulinum toxin to relax the lines and the wrinkles, get rid of this crow's feet plus the frown wrinkle here. And we also did injection of our dermal filler into the nasolabial line plus marionette line here. And we noticed an instant improvement on this left line here. And we'll further see more changes as time passes by. Like your upper third, you'll see gradual reduction of the lines and the wrinkles in 2 weeks' time. And also the filler, the hyaluronic attracts water, so it's still gonna plump up and further volumize. Okay, Ma'am Cathy, we'll see you in your follow-up.
Thank you, Doc.
Oh, you're welcome. Thank you. So Lloyd already had treatments in the past, like tread lifting.
Yes.
And you have experienced already some injections of fillers, even Botox, right? So, you know, in your career, this is what we want to, you know, maintain. Do
Right.
some treatments on our face. We only have one face, and of course, we want our face to look best.
Yeah.
Right? So for now, actually, if you look at the upper half of the face, Sir Lloyd, yan. So we have concerns of these lines and creases on the forehead area, and then also on the sides of the eyes, the crow's feet, and we have also this so-called glabellar complex lines here, okay? And we need to do something about those because the lines are increasing, they're not decreasing. We need minus reduction.
Yes.
Okay. But for men, it's an advantage that they have some few lines. Kind of it adds to the masculinity.
Right.
And they were saying years of experience or wisdom, full of wisdom. Yan. And then also the concern of the hooded eyelid, okay? So we want to do something about that. Now for men, we also check on the position of the eyebrow. We don't want men to have the
Eyebrow lift.
yes, we don't want the high arched
Yes.
eyebrow. So for men, it's just like more of a straight eyebrow. And of course, we want it symmetrical. And then the under eye area is also a concern. So we have puffiness there, some laxity, skin laxity, plus the so-called tear trough and volume loss already, which is actually classified number 3, class 3. Okay,
Yeah,
class
that's been my
3.
problem talaga, Doc.
So from the middle to this lateral aspect, we have the so-called groove, tear trough to the palpebrommalar groove. So we want to do something. We'll start with the upper half today. Okay, so we'll do like a you know, a session by session treatment. We'll work on the upper half. Actually, right now, there's a lot of periorbital rejuvenation that we're doing. We're working around the eye area. And then next time, we'll work on this lower half. Actually, when we start with the upper half, we sometimes see the lower half is also improved. Kind of like if you do some lifting on the upper half, it's kind of also lifting the lower half of the face.
Okay.
So, we'll do a treatment called like a combination. We'll do some toxin relaxation of the facial muscles, but in a natural way. Plus, you still have a facial expression. We don't want you like frozen face.
Yes, yes.
Okay. And then combine with a thread treatment on the under eye, which is made up of like protein filaments to stimulate collagen and elastin to restore the firmness and natural elasticity of our skin. And then next time, we may do some, you know, combination also thread lifting, jawline definition, and also further reduction of laugh lines and tightening of the
Yes, yes,
skin
this one.
in the neck region. Okay?
Doc, just
Yes.
for the sake of the viewers.
Yeah.
For someone who would undergo this treatment, like let's say you're gonna work on the forehead, right?
Yeah.
What would one feel when
After the treatment.
No, I mean during the treatment.
Oh, during the treatment, it's normal to feel the pricks from the
okay.
tiny pins. Actually, I use the tiniest needle here for, you know, reducing any discomfort there. Plus, of course, we apply numbing cream. I have some patients, they tell me I don't feel anything. I have some patients, oh, it's just like a tiny prick or like an ant bite, okay? But, you know, we differ in our pain tolerance. Some people have high tolerance, some people has low tolerance. So depending on the pain threshold level of the person. But in my case, like I do myself, I inject myself, like you feel the tiny needle pin, but it's okay. But as they say, no pain,
No gain.
no gain. Okay? So
Yeah,
let's start
alright.
the treatment. So as a summary, we have done combination, toxin upper third, and we also did soft filler on the static wrinkle, the one here on the so-called glabella. So it's a dented line, and the problem there was the skin layer already, because Botox works on muscle. So if there is a tear or like a dented line in the skin, we need to correct it with soft filler, because we're placing it on the superficial skin layer. So we only need something very light, low molecular weight type of filler. Now for the under eye puffiness, we did also combination. I did also micro tox. We call it like a minimal dose of your botulinum toxin to relax the orbicularis oculi muscle. Plus we use those super tornado PDO threads to tighten and firm the skin because there's laxity already, and somehow restore volume in the so-called tear trough area. Okay, so your PDO threads will help build new collagen and elastin. So this will work in 12 weeks time. New collagenesis will happen in 4 weeks, 8 weeks, 12 weeks, and so on and so forth. Plus healthy lifestyle. Okay,
Maintenance.
yes, and we'll do some more maintenance treatment for Lloyd, of course. So this is our first treatment, and we'll have more follow-up treatments. Thank you so much, Lloyd.
Thank you so much, Dr. Contessa. And guys, don't fail to visit Angeles, and this is CSA
Yes,
Medical
thank
Aesthetics.
you. And I already am seeing some results right now, some reduction in the puffiness in the under eye. Okay, thank you so much.
Thank you so much.
Yeah.
Thank you.
Today's episode, we have a follow-up. Let's welcome Ma'am Pinky Marquez.
Yes, I'm here again for a follow-up after 2 weeks, I think. No?
More than. Like,
More
it's
than
already 3 weeks,
3 weeks
actually,
na tayo.
okay? So now, this is the time that we analyze what we've done prior. So we had the injection of botulinum toxin on the forehead, the crow's feet, the glabella, okay? That's why it's important that we check you 2 weeks or more than 2 weeks after to analyze the response of your facial muscles. So right now, we are checking on Ma'am Pinky. We already were able to treat the glabellar complex, the center part. Her concern was that kind of like lines.
Big muscle.
Yes.
No lines, but big muscle.
The muscle we call here the corrugators and the procerus. So we relax that, but still in a natural way, and she would still have a natural facial expression or some facial movements there. Now we'll do a touch-up, the so-called like treatment for muscles that are still dominant or still strong. So her muscles that are still strong would be your lateral frontalis, the sides, lateral, and the right side is stronger than the left. So we have seen that the right eyebrow is going up a little bit higher than the left. Okay, so the tail, it's the tail of the eyebrow, still strong, dominant. The muscle fiber from the lateral frontalis is still active. So we'll do a balancing on that one. And we have noticed already an improvement of the so-called laugh line or nasolabial fold. There's already a significant reduction. That was just 3 weeks ago. Actually, you will still see some more volume improvement or tissue expansion with the hyaluronic filler because it attracts water 10,000 times. So, Ma'am Pinky, hydrate, hydrate, hydrate. So it will still improve. And we can still add on for the marionette fold or labiomandibular fold some more soft filler, soft hyaluronic substance, low molecular weight to still improve the line. And now we'll be adding a so-called what we call DAO injection, the depressor anguli oris. It's a muscle that pulls down the corner of the mouth. So we need to relax this muscle so it doesn't cause any downturning of your oral commissures. So it makes her this kind of sad look. There you go. So this one. So we will relax the depressor anguli oris here. And I will add also the so-called jawline definition with Botox. We'll relax the so-called platysma muscles because the platysma muscle pulls down your lower part of your face, giving you that further sagginess, kind of like the downturning of all the tissues on the lower part of the face. And we'll still do some balancing check together with the nasolabial fold there. Okay, so let's start the treatment. Ma'am Pinky. So we have done a treatment for Ma'am Pinky. Okay, so this is her follow-up treatment. Let's show to Ma'am Pinky. Ma'am Pinky. So like after 3 weeks today, we have done like a correction of the lifting of the tail of the brow. And then we added some more dermal fillers on the nasolabial line and the marionette line. And I did also a relaxation of the so-called depressor anguli oris to kind of correct that downturning of the corner of the mouth. And plus jawline definition with our botulinum toxin. How are you, Ma'am Pinky?
I feel good.
Yes. Okay.
Ready to see the results today until 4 weeks.
Yeah. So with fillers, actually with fillers, you can instantly see some changes there. But the fillers will still work. They're inside your soft tissues. They will still correct any, for example, volume loss and further hydrate the tissues. That's why we recommend hydration, drinking more water. So after this, so we will be having some massaging of the filler that we placed. So we use more filler on the left side than the right side, okay? So we'll have the filler still work and it will still change. And we'll wait again for the botulinum toxin for about 2 weeks. So Ma'am Pinky, thank you also for inviting your
Oh
friends.
yes, they're from they can influence a lot of people because people are just scared, but there's nothing to be scared about.
Correct. Yeah, that's the
You will
concern most of
age,
the time.
but you can uplift.
Correct. It's scarier to become
And
more
the
older.
emotions, the feeling. Look at that. It
Yeah.
used to be deep here, guys, but look.
It is already getting better. So
See?
this is gradually improving. So as time passes by, you'll still see more improvement of the skin tissue and the surface area, okay? Because you know, lines, wrinkles, it didn't happen overnight. So it was also like a process that they came out, and like, you know, when you were busy or during pandemic time, we're not able to do these kinds of treatments. So right
not
now,
allowed.
we want to do also a maintenance treatment for Ma'am Pinky. It's important to do your maintenance treatment. The procedures that we do, the non-surgical ones, these are not permanent. Even, you know, even if you've done surgical facelift, it's still not gonna make you permanently young looking, even surgical procedures, okay? So these kinds of treatments, we need some maintenance procedure to, you know, keep the skin tight, firm, and also more collagen and more elastin production there. And we did on Kathy, because it's her first time, we did some Botox, initial Botox, and some soft fillers, okay? And we'll check on Ma'am Kathy for some more improvements. And also Lloyd.
We'll be
back. Lloyd had this combination, the Botox on the upper third, and we work on the under eye using our protein threads, and we'll see more of improvements for that one. Thank you so much, Ma'am Pinky. Thank you for bringing your friends, your group.
This is the journey that you must take.
Exactly. Thank
With
you
CSA.
so much. Thank you, Ma'am Pinky. So, for those who have questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other episodes with Ma'am Pinky. We had how many na ba?
Many years na.
Episodes na with her. Yeah.
4 years.
Yeah, okay. Thank you, Ma'am Pinky. We'll see more of you.
Come to this clinic and check it out.
Yes.
So many new procedures. And she's
Right.
been teaching all over the world doctors how to do this. So come here, trust us. CSA Medical Aesthetics for any procedure for the whole body.
Yay! Thank you so much, Ma'am Pinky. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.